Welcome to episode 5B of the Career Cumulus Spotlight series. Today, Joanne gives us a glimpse into a day in the life of a clinical manager. Can you walk us through what a typical day as a clinical manager is like?
A clinical manager, it's an ebb and tide. It's fluid, I should say. Where you go ahead and you get report on all your patients.
Okay.
So not just as a nurse, your 2 patients or 6 patients, whatever, you get in the whole unit. Okay, so you have a good overview of what's happening with the patients, and then you go over the staffing. Who's going to be on for the next shift?
Okay.
So you make sure you have enough staffing for the next shift, depending on the amount of what your census is. And then you basically go around, see if anybody needs help. You respond if there's an emergency on your unit. You respond to those emergencies. You lend help to the nurses. With me, because I said my manager was very much into teaching, we would have between my other counterpart as a clinical manager, but she would work on the schedule, and then I would work on payroll, and then basically was putting out fires. If there's issues with staff, if staff with staff, or if there's an issue with a doctor, or just putting out those little fires that I was able to do that didn't require my nurse manager to pull her away from what she had to do. If I had to set up a meeting because maybe the family members didn't understand stuff and they were frustrated or whatever, then I would make sure to set up a meeting maybe with the doctors and that particular family member to go ahead and meet up, to discuss the patient's care, what's the next step, different things like that. So you kind of do a little bit of managerial, but it's more of the clinical aspect. I helped out with ordering sometimes. You would work closely with your nurse manager, because if you're over budget, you have to try to see how you can safely take care of patients, but also stay at or under budget. So it's a delicate balance, and that could all go out the door if you had emergencies.
Gotcha, because that was priority.
Because that's a priority.
And Joanne, the clinical manager role, is that an hourly role or a salary role?
It's an hourly role.
Oh, it's still hourly.
It's still hourly.
Okay, so you have the opportunity for
To
overtime.
Yes, definitely.
Okay. And then it sounds like the type of individuals or roles that you're interacting with are the same as a nurse. So you're interacting with the unit secretary, the PCAs, the doctors, the patient's family.
And then I'm also interacting with the supervisor, house supervisor, who sometimes is the big coordinator for beds. Because if, for instance, my patients were leaving the ICU, I needed a bed in a special telemetry unit or something, I am talking to that supervisor and saying, I have a male patient that needs to go to telemetry unit, and she would assign the bed, while she worked in conjunction with the clinical manager from that other unit. Or if there was a patient coming out of a procedural area and they needed to be monitored in the ICU, they would say, well, how many beds do you have? Can you accommodate this patient? And I would say yes, and I would give them the assignment, and I would tell the nurse. I would be dealing with, also other departments, so it's a very, as you get, you're dealing even more with different departments, different managements, because it's a cohesive thing.
Okay. Thank you for joining us today. Stay tuned for our next episode, where Joanne takes us through some key highlights of her journey to becoming a nurse manager. Don't forget to like, comment, and share this post, as well as follow us for more career insights.